Hello and welcome to Sarva Gunn Sampann. Thank you so much for joining me on this platform where I have the great honor and privilege of showcasing and spotlighting the unique perspectives, personalities, and lived experiences of women of India and the diaspora. My guests are not celebrities in the conventional sense, yet they serve as excellent role models to many women all around them and the communities that they live in. My guest today is a woman who values honesty, integrity, and transparency. Her strengths include her willingness to go the extra mile to do what she perceives to be right for her and for others. Please join me in welcoming Dr. Kamala Adury to the show. Kamala, what a privilege and honor for me it is to have you. How are you doing?
I'm doing good, Anu. It is a privilege for me that you think me worthy enough to come and talk in your show. So thank you so much for having me.
It's an honor for me, Kamala. Thank you very much. All right, so we'll get started with this podcast, and you're familiar with the format. Our first segment is about your childhood. We call it Bachpan Ke Din. And here, I'd love to take you back in time and help us learn about what your journey has been like. You know, your early influences, your friends, your schooling. What were some of the things that helped shape the person you've become today? So let's go for it, Kamala.
Yeah, it's such a deep question. It's so profound and so complex to even answer. I'm sure that a lot of that has something to do with how I am today. I mean, my childhood was very conservative, traditional, small town upbringing, middle class family, parents, middle class values and virtues. Other than the traditional and conservative upbringing, the rest of it was pretty offhanded. Like my parents would think, oh, if she doesn't do anything, we'll just marry her off. Not a big deal, kind of thing. So which used to make me feel furious. But I used to be interested in art and competitions. I would also quickly get burnout from competitions. I used to do well, but I would say if I had more guidance, more mentors, maybe I would have known how to manage the psychological environment regarding competitions, because that's a different beast. But I used to love a lot of different things. I tried to love music. While I was doing it, I thought I gave it my all. So at least that I cannot have any regrets about. Art was my love. It was my passion, and it still is. I don't do a lot of art, but I always have that in the back of my mind. I always explore artwork. I'm always interested in anything that's artsy, fine art. Fine art, I love it. So love of animals, that was huge when I was growing up, rescuing animals in trouble or just pet sitting. I was, of course, scared of snakes and stuff, but any furry animal, I was just in awe and in love with animals. So, I mean, there are some fond memories of that. Befriending a monkey that belonged to a neighbor, and that is something that is always going to be a special memory for me. Some incidents related to monkeys and such. I mean, just like it was the kind of place that we were at, which was frequented by monkeys, and there were some experiences related to that. I think about it, and these are just heartwarming memories. My father had a transferable job, so we moved around a lot. So there were a lot of breaks in friendships because of that. I always had to like start fresh, always. In those days, I used to grieve the loss of some friendships, and it used to be difficult in those days because we didn't have social media like we have today, and it used to be the days of postcards and the typical the blue color letters, and we would try to be in touch here and there, and then eventually that would fizzle out. Over the years, we have tried to reconnect, like just a couple of those friends, but I always had friends, but always had breakups. It kind of helped me be more resilient, I guess, in a way, is what I would like to think. So I don't have any hard feelings about that. at least, and that's a plus, I think. My parents, they always used to ask me to be humble no matter what, regardless of how your grades are, whatever. Your job is to be humble. Don't speak in front of elders, all that. So the indirect message being, you just shush, you don't talk much. That became predominant in my later teenage years, which I do have an issue with, but it is a done deal. It was done. The best thing you can do as an adult is to move on. Yes, that impacted me, but also that is something that I had to overcome also. And I firmly believe in a journey of life where we always have something or the other to work on, and that's never going to stop.
Thank you so much for sharing, first of all, aspects of your childhood. I'm assuming you grew up in the eastern part of the country?
Orissa.
Orissa, okay. All right. So,
Yes.
yeah, it's great to know all the varied interests that you had. And I think when you talk about your childhood, you're also talking about millions of girls in that generation who
Yes.
pretty much had a very similar story to share,
Yes.
very conservative upbringing, values that always put society first. You are definitely multifaceted. You're one of the smartest people I know. And you're not just a high achiever, but also with your kids, the way you've raised them and the kind of things they have achieved. So that's one quality about you that I always admire is your humility. But for you to come out and say that you've had issues with that because inadvertently sometimes parents push it down where modesty becomes like so overrated. So hopefully we will try to hold that back, that desire to push that down our kids and make them feel like they are underachievers in spite of all their great achievements. I think that's that's something that
that is a very important point you brought.
Yeah, no, it's
Yes,
true.
it was exactly that in our days.
Yes.
It's so funny the way you brought up. Yeah.
While we deal with that for a long time, I think it takes a certain level of maturity and coming of age to actually look back and just give it the importance that it deserves and no more.
Yes. Right? Yes. You move on. Don't get stuck there. It's okay. It's over with. As long as we are not doing that to our children, we're good.
Right. So talk to me a little bit about your schooling and what were the subjects that were of interest to you, and we talk about this till your high school.
Yeah. So as far as I know, I was always I always studied at Kendriya Vidyalaya, and in those days it was an inexpensive way of schooling plus high quality. So it was central education. So even though I always moved in or within Orissa, because I used to go to Kendriya Vidyalaya, there were children from all over the country, like from military backgrounds or from other central government backgrounds. So I was always exposed to kids who spoke various languages, kids who were from various cultural backgrounds. Sometimes my friends would be Oriya, sometimes my friends would be like Hindi speaking or Bengalis. So that way, yeah, I would agree that it was varied in that way. Even though, like, yeah, at home, the same old, like, okay, everything is, there is a certain structure to, so there is a certain limitation to what you can do, what you cannot do. But because of the exposure, I guess maybe it helped me be more liberal in my mind in a way that I could question sometimes some of the values, even though I wouldn't do much out of love and affection for my parents, but at least in my mind, I would question those values. I would reflect on that and see how productive it is and things like that. As far as academics went, I was pretty good in academics. I was always driven. My favorite subjects were always life sciences, and there was like no doubt about that. I used to like math too, because in my opinion, math was very simplistic. Like as long as you know a formula, you used to get the answer right. And that kind of grabbed my interest. So yeah, subject-wise, I used to like most other subjects, but my favorite was life sciences. Um, and I used to do fairly well. I was always in the top few in the class. I was probably the only time I was top in my class was plus two, in senior year of plus two. Other than that, I was always like, third, fourth, whatever. Yeah.
So you topped when it mattered the most. So that's great to know. All right, Kamala, we'll move on to our next segment here, which is Ye Kahan Aa Gaye Hum. And this is where you talk about your college, your choice of a career, program, the subjects that you studied. And so you went to a medical school, and then you got married, you relocated, you came and started working in this country, the United States. So it's a long span that we talk about, but
Yes.
where you actually grew up and life happened to you. So yeah, let's get on that journey.
I used to be driven, but my drive would always go like this. Sometimes I'd be very driven, and sometimes I would be laid back, oh, okay, I don't want to work that hard, kind of a deal. So I did try to take the easy way out. Plus, the circumstances at the time weren't that conducive anyway. And I tried to take the easy way out by not taking any of the competitive exams, or even if I took, okay, without preparation, that kind of deal. And I quickly realized that I just wasn't meant for anything else. Is when I put some focused effort in clearing those entrance exams, and I made it to med school. After that, life has been very fast paced, full of activity, full of experiences, full of changes. Med school was challenging. I, in fact, not anymore, but until recently, I used to get dreams of failing my tests in med school. So you can imagine. I was sitting for an exam in my medical school and I didn't remember, or it used to happen until 4 or 5 years ago or so. Finally stopped happening. So that is how deep med school can affect you. There is always this threat of failing and getting a year behind, or always this threat of not knowing your stuff, or just being intimidated by your the professors, or are you in good terms, not in good terms, or what not, what else are you doing? And there is a lot of scrutiny there. It's high pressure. Med school is not at all easy. But I never failed a test or anything, but for whatever reason, I kept having those dreams for a long time. I mean, not all the time also, but maybe couple times a year, I would get those dreams. And I used to find it so weird. Yeah, so then marriage happened, obviously, arranged marriage. There's what else can be expected out of so many women that in that era, right? And it was, I mean, we were both educated. It happened with mutual consent only, and our parents were respectful of our take on that particular match, right? So they were respectful. And marriage happened, and I wasn't anticipating moving out of the country. I used to always tell my friends, "Oh, not me. It's not patriotism and all that stuff." But you know, it's not in your hands at the end of the day. A lot of things are not in your hands, is what I believe. Yes, I could have put my foot down, but I would have had a disgruntled husband by my side. I mean, would I want that? No. I mean, so, okay, fine. I followed him, but then I had never planned for education in United States. At the time that we were married, he was working in India, and his father was my husband. His father wasn't doing that well, and the plan was that he would be in India only, that he won't go to United States. But stuff happened, and within a few months of our marriage, we had moved to United States. and realizing that I had not taken the steps that are needed to go into training, and I realized it's a long ordeal. My future was questionable. A lot of people in my situation ended up clearing USMLE or ended up staying at home. And obviously, I didn't want that to happen to me. I did want to clear my steps and all that, which happened, and other experiences came along that helped me, and I finally did my residency at Cleveland Clinic in psychiatry, which was my passion. Um, I uh, I felt like I could relate to people who had mental health problems. Um, and over the years, I had also seen and experienced close family members having mental health problems. So this was something that was home for me. I will admit that I didn't quite know much of anything about psychiatry when I started the residency, which is how I guess it is. So we don't get any education when we are in medical school. Not much. I mean, you get a chapter or two. Maybe you do a month of internship, and that's about it. So, as important as mental health, there is hardly any education there, and most of what medicine is actually med focused or medication focused, and which doesn't work for mental health always. So, anyways, I did my residency, and I realized how intricately mental health and sleep are connected. So, which inspired me to do a fellowship in sleep medicine. By that time, I had my two kids. They were young. My husband was commuting a lot. It was it was a struggle. It was uh, probably a little bit short of calling it hell. Uh, Very challenging, very challenging to navigate this that particular phase of my life. However, it was done. A lot of things went against me. A lot of things cooperated with me, and altogether, I was able to finish and landed a job at Akron General. So, and that is when real learning happened, is what I believe. Even to this day, I learn from every case that I see. Some subtleties of human tendencies, behaviors, dynamics. Um, every case is a teaching point for me. And some of the positions that I was in, like I was a medical director at an intensive outpatient program during that period of time, and that was an eye opener to a different realm of mental health, which probably most people are not aware of, like the psychodynamics, the mind, how it can play a role in clinical conditions. I learned as to how better to look at a person as a whole rather than just being hyper focused on just the condition that the patient came with, such as depression or anxiety. I was able to look at the person as a whole, treating the person as a whole rather than going through just one modality of treatment and just focusing on one condition and ignoring the rest. I was able to hone my skills in making a positive treatment outcome as a focus.
That's great information. Thank you so much for sharing, aspects of your work, which I'm sure we'll be talking more about in Kaam Ki Baat. But before we move on to our next segment, I'd like to also learn from you about what you did after Akron General. So you stayed there for 10 years and then you pivoted. So talk to us a little bit about that.
So I realized that the corporate world was not for me. Corporate medicine has its own pluses. It does give a stability of job, stability of income, stability of a career, some protection, uh, but it doesn't give this satisfaction of being an optimal clinician. At least to me, it didn't. There was this pressure of seeing more and more patients or doing this many number of sleep studies, or there is always a pressure, and that pressure can inhibit one's own personal growth. Um, not only career wise, not only if you want to do something else in life, you can't do that because you're constantly trying to please that system. and you realize that you can't please that system enough ever. So there is a time when you are at crossroads with that, and you have to make a decision as to what you want to do with the rest of your life. And I was at that point where I have 15 some years. What do I want to do? Do I want to keep doing this, or shall I just go and do something else that I like? And that is when I left Akron General, and I started my own practice. It is called Center for Behavioral Health and Sleep Disorders. I treat any sort of like psychiatric or mental health problems, and any sort of like sleep problems. So it has been a revelation, because being on your own, you don't have that protection. You are completely exposed. You have to handle that sort of an environment with tact, with much care. There is pluses. I have flexibility. I can work. I can choose the hours I want. I can decide the amount of time I want to spend with the patient. I can do other things that may or may not have been available when I was employed. I have a TMS device. It's a transcranial magnetic stimulation device that I use for treatment-resistant cases of depression. It's an electromagnetic therapy. I do that. I feel like when it comes to pertaining to both these fields, and a lot of general medical problems too, right? See, as I said earlier, that I look at the person as a whole. So then there is so many things. There is so many things. The person could be presenting with depression. However, the person could be on some meds that could be contributing to the depression. There is a history of trauma that has never been addressed, or there is some other medical problems. There is as common as diabetes, or there is concurrent sleep problems. And sometimes people have a few different types of sleep problems, like sleep apnea, restless legs, and insomnia. Or sleep apnea, acting out dreams, and insomnia, or just shift work, anything, and let's say chronic pain that affects sleep, that affects mood, that brings down the quality of life for so many people, leads to disability and other issues, relational problems. So the main problem could be chronic pain, but the patient could be coming to me with depression. So I can't just focus on depression and get things rolling and expect that there will be a good outcome. I would need to help the patient get some tools to cope with the pain. If I feel like the patient is not getting enough help with pain management, what can I do from my end? And also, do I need to make a referral? Things like that. So these are just examples as to how I look at the patient as a whole, but also educating the patient about the importance of prioritizing overall well-being rather than just not feeling depressed. So not feeling depressed is, in my opinion, not the bestest outcome, because that by itself seems to me more negative than anything. So if something is kind of negative, then how are we going to feel better? So I try to educate a person, work on the person's mindset or outlook or perspectives as to what they're coming in for, and what actually is going to help them. And I'm a big proponent of having the patient be the chief. The patient needs to understand that it's not just the responsibility of the physician to get him or her better. The responsibility also lies in the hands of the person or patient. So by bringing up these things, I'm kind of increasing the ownership. People feel that, oh, there are certain things that we can do on our end. And there are certain things that we can do on our end to help the medication, help more or help for a longer period of time. A lot of medications stop working. Antidepressants, they're known for, initially they work well and then they stop working. There are reasons. People coming in, okay, I have ADHD. I consider something like ADHD or insomnia as a symptom, not as a condition. Because when we look at that as a condition, then there is no more any ownership here. All the ownership lies on the physician. So the thing is, there are certain things that the physician or the clinician cannot own. There are certain things about the patient that the physician cannot own. The physician cannot own the pain, for example. The physician cannot own the trauma, for example, right? Yes, the physician can put himself or herself in the other person's shoes, which is very important to be able to relate to what the patient is going through. But at the end of the day, there are a set of things that need to be done by people in order to feel better. And that is where I focus on. Plus, helping out with meds. I'm not completely against meds. I am an advocate of using medications, but also understanding that there are some limitations. Also understanding that they can be very life-saving.
So thank you so much for shedding light on your approach, which is definitely in the best interest of the patient, where you're trying to target the person as a whole, and not look at any particular thing in isolation, but you're trying to make sure that you're providing the optimal care for your patients, but also laying the context for why you decided to combine sleep medicine with psychiatry, because they're both interconnected and obviously a very complex field, which I'd love for you to shed a little more light on in our next segment, Kaam Ki Baat.
There are some logistics about taking on psychiatry as a career that I like, and the logistics are that it's hands off. There is no instruments involved. You don't have to bother with doing vitals, or you don't need to do like incisions, or you don't need to hold a scalpel ever. There is no need for any of that. And that sort of a career appeals to a lot of physicians. Actually, it does, and there is enough exposure. There is, for me, it was important that I interact with patients. Pathology and the fields that did not need that sort of interaction, like radiology, pathology, I never was interested in those areas. Even though initially in med school, I wanted to be a surgeon, but by the time I was done with med school, I wasn't that interested in being a surgeon anymore. I was more interested in just being hands off. I didn't want to go through the stress of cutting up people and sewing them together again. I didn't want to go through that.
You were traumatized enough. You were traumatized enough that you were getting all nightmares or failing medical exams. This is one less thing off your plate.
By that time, my life was as such intense enough, and I didn't want to make it more intense by choosing subjects that were just impossible. Like being on call all the time, or having to attend to emergencies all the time, or that becomes tedious when you are when you're married, you have children, you're a woman, and you are carrying that baggage, the baggage of patriarchy, where you are supposed to like delegate all the responsibilities no matter what. I mean, I'm not by any means saying that my husband wasn't cooperative or anything, but still the baggage always loomed upon me and many women in my situation. So I had to make a logical decision, also a decision that was home for me. So that's what I would say is for people, when they consider a certain career path in medicine, they take all these considerations into their perspective, and they make a decision.
You've been practicing this for a while now. You've been in this field. What do you see in terms of mental health issues? Do you think they are more pronounced today? Are you seeing an uptick in cases, maybe if you compare it with 10 years before, 10 years ago? And what do you think are some factors which are responsible for mental health issues in population today as you see it? So talk to me a little bit about the societal context for your practice?
So, I mean, mental health was prevalent then, and it's still prevalent now. Um, the the behavioral aspect of mental health has taken a course for the worse. I feel like people post pandemic have lost their filters. The niceties are not there as much. People don't make eye contact. People don't say their thank yous or sorries or whatever as much. Um, there is a lower threshold to just snap at each other, is what my observation is. And also, there is a very, very, very heavy dependence on social media and devices. And that is causing a problem in its own. In terms of, I see the difference in cases of, like, suppose, say, OCD. Before, when I would see OCD, it used to be like germophobia or um, other, like counting rituals or touching rituals or whatever and all that. I have noticed a subtle change where the symptoms of OCD, suppose, and it's just an example. And I'm giving this example because I recently came across this. Uh, it's more like OCD is more like intrusive thoughts. Intrusive thoughts are supposed to be weird by themselves, and it causes a lot of distress to people. And it causes profound guilt for having the intrusive thoughts because they have unpleasant content. But I'm noticing the younger generation who play a lot of video games or just do devices, and they have exposure to so many news channels and so many conspiracy theories and all those things. So the intrusive thoughts has taken a different turn. It is much more harder for them to explain because they're so ridden with guilt that they can't even express themselves. I don't want to, like, mention the specific contents of the intrusive thoughts because it's not pertinent to this talk, but I would say that has changed.
So when you talk about intrusive thoughts, and I'm sorry to interrupt here, you're talking about thoughts that are coming into the mind because of some content consumption. Is that correct? Is that accurate?
So intrusive thoughts are thoughts that seemingly come out of nowhere. They just drop in your mind and you get hung up on it. And those thoughts, or it can be visions also, they can be pretty distressful because of the particular content. And the person, like, is not able to understand how the thought even came or how the vision even came. So there is a lot of there is high levels of distress related to those thoughts.
And you're seeing that in the younger generation.
There's who are more obsessed with devices and video games, and I see there has been a shift in the content of the intrusive thoughts. And the other issue is also that they don't want to step out of their house to seek mental health, help with their mental health problems. They want to sit in the couch or sit in the bed or on the desk, wherever, and they want to do virtual visits. And it's a plus for some. Suppose, say, people in college and they don't have easy access to mental health, clinicians. So it makes sense. But a lot of the other people, like, there is no reason for them to be at home because being at home is part of the problem. It either contributes or worsens their social anxiety. So how are we helping by doing virtual visits with that particular population? So those are some considerations, and I try to encourage my patients to see me in person as much as possible. Them making that effort increases their chances of working, putting in some more effort in their, like, specific recommendations that I'm making, suppose, say. Sometimes I give recommendations as to what they should be eating, to how much exercise they should be doing, to like going to a program or anything, or joining a gym or whatever. So a person who is likely to come in person, take the effort to come in person, is more likely to put in some more effort in making those other changes. And I believe that, coming in person, seeking treatment in person helps for a better treatment outcome.
So, what are some signs and symptoms that we all should be looking out for, where it's so easy to brush aside mental health issues because everybody has thoughts that are always not so pleasant. Sometimes you go through depression, sometimes you get upset over nothing. Sometimes it's compounded by hormonal changes, especially in teens. So it's a universal phenomenon, right? Everybody cannot be happy all the time. You go through ups and downs. But what do you think are some red flags that parents should know, whether they're young kids or teens or adolescent aged kids? What are some signs and symptoms that they should not ignore and seek mental health and professional help?
It's a difficult age group. Adolescence is a difficult age group by far. Children that age don't communicate with parents that well to begin with, and they are not that self-aware to begin with. So how do we recognize, right? So some of the ways to recognize mental health problems in that particular age group is, first of all, to have the awareness ourselves, right? If we don't know that there is something called mental health, then how are we going to look for something, right? So reading up things is important. What are the possible mental health problems in children? Okay, so depression, anxiety, all that applies to adults also apply to children that age and also children any age. Everything, insomnia or even sleep apnea. Some children even have sleep apnea. Pay attention to how they sleep, when they sleep, having a ballpark idea. I'm not saying we hover over our children. We don't need to do that to know what they are doing. All we need is just keep an eye in a roundabout way, and we can get some info. That age group, children that age group have they struggle with sleep across the board, is my opinion. So when does that sort of a problem become a problem? It's something that's universal in all children. Sleep issues, behaviorally induced, meaning they have to, for whatever reason, they have to stay up late at night to finish their assignments or whatever. And then they have to get up early in the morning to go to school. So now there is a kid who hasn't slept enough, who is kind of sleep deprived and can be inattentive as a result of that, may not, may or may not struggle with grades, things like that. So one of the ways to keep an eye on that would be to kind of just have I'm not one of those people who believes in helicopter parenting or anything, but if we see a decline in grades, a significant decline in grades. Now, I believe that every straight A kid must get 1B before graduating high school. That is what I believe in. However, if you see a steady decline in grades, then that's a red flag. If you see a kid doing too much of video games, I would really be concerned. I know that parents tend to think that it's normal. I wouldn't say it's normal. If parents are allowing their children to spend like 4 to 6 hours or more in video games every day or every week, I mean, that's not normal, in my opinion, because that itself is a petri dish for mental health problems, is what I believe in. So things like that. Sleep is one, grades are one, any hint droppings. There, as non-talkative as they are, they can be with parents. If once in a while they come and they happen to say something, pay attention to that. Like they might just do some sort of hint dropping. Oh, I don't know the purpose in life or something like that. They might drop a hint like that. Pay attention. Having an open channel of communication does help. It is very, very important when talking to your adolescent that you not react. We are all guilty of doing that. I am also, but my learning is that it shouldn't be done. That's not how it should be. You don't react. And I did, even because we are not from that background where our parents never reacted. I mean, our parents did used to react when they were raising us. They used to have a lot of expectations in terms of, oh, you be this, you be that, you dress like this, you look like that, and this and that. All of that used to be there. So for us, when we are raising this current generation of children, should not be our parents, because everybody eventually become their parents only. We always model after parents. So those tendencies do act up. And we do have a tendency to react, but we have to work on it. And we just need to talk. Just have an open communication. Do not react if the child is talking about suicide or talking about whatever. Just listen. Just listen and let the child talk. Get a perspective, and then go from there.
And that's very valuable advice. I'm sure people who are listening, parents who are watching this information, the advice you're giving are really appreciative that you're touching upon these topics. The one concern I have is that, this generation is spending a lot of time on screen. And even if the kids are not playing video games, the learning is happening on laptops, on devices, even when they're home, easily an hour and a half, 2 hours of screen time. It's a lot of screen time, and it's very difficult to curtail that. I just don't know if I'm the only one that's feeling like that, but I feel like that's becoming a universal problem. And what are your suggestions? What do we do to break out of this mess?
I don't think there is anything we can do about that, because everything is on devices. All their assignments, classroom, classwork, homework, any sort of other projects. If they are in extracurricular activities, everything is being done through devices only.
Yeah.
So there is nothing much we can do about that. However, what I would recommend is just not advocating video games.
Yeah.
Having a limit on that. In fact, banning that. As a parent, you have the right to do that. I don't believe in helicopter parenting again. However, I believe in setting some boundaries that are kind of not too restrictive or suffocating to the kid. So the way I approach this is, I never told my children to get good grades. However, I didn't allow video games. So what are they going to do? I didn't allow too many social media sites either. I didn't tell them to study. I didn't tell them to go, you have to get straight A's, or you have to do this, do that. However, that boundary of, okay, no video games, and other than what the school requires you to be on those particular chat rooms or whatever you want to call that. Other than that, no other social media exposure. Now, I'm knowing that they still have access to YouTube, they still have access to Netflix, and that's okay. I don't care, So when you have those boundaries, and what do the children do in their free time then? It's more likely that they will do something more productive. I mean, that's what happened in my case. It's not like I banned the video games like forever for my children. But what happened was, one summer we were on a vacation, and I found that my children, instead of enjoying their time in the beach, they were spending some time in the beach, and they were coming back to the room and quickly doing some games and things, and they couldn't wait to come back from the beach to do their video games.
Yeah.
And 3 days went by, and by 4th day I lost it. I said, okay, we're not doing video games for the rest of the summer.
3 days, the kids know that. 4th day, mom's going to be on a case.
We are on a vacation, right? It's Hilton Head or whatever place that was. And well, we are supposed to be outside, enjoy, because we don't get that in Cleveland, right?
Right.
So I ended up banning video games for the rest of the summer. But what happened was the children realized that they were able to be more productive without the video games that summer. Like they were in competitive games or whatever, they realized that they did better, they performed better, their focus was better, their productivity was better. So then they saw the incentive and they decided that, okay, fine, I'm not interested in video games anymore. I don't need to do that. So that's what happened. Now, as a parent, I wouldn't push my child into being, um, number one chess player or number one this that. I wouldn't. It's strictly based off of what the child wants. My job as a parent is to give resources, is to make sure that if my child wants to go somewhere, then I take the child wherever. And my job is to not question the child about that, because it's not like he's going to a nightclub, so why should I question that? So just take the child. Just any other resources, just give the resources. Have a calm environment, nurturing environment in the household. Avoid fights, or sometimes parental fights have a negative influence on children's mental health, and that is something that we made sure to not do. I mean, if we did maybe 2 times over a period of, let me say 4 times over a period of 10 years, we might have done it. It wasn't a regular thing. If we had issues, we would solve it behind closed doors. So things like that.
Very helpful. What advice do you have for women who are dealing with sleep issues? What do you think are some challenges that women should be aware of? As we age, I think those sleep disturbances become more pronounced for whatever reasons. I'd love for you to kind of shed a little bit light on that and talk about any risk factors or what can be done to prevent some of those issues in women insofar as sleep goes.
I'm glad that you brought up sleep issues and you didn't mention like a particular sleep condition, because that's very important that we stick to the symptoms. We stick to the symptoms and then we figure things out, right? Because a lot of the times it's a set of symptoms. A few of that set could be because of one condition. A few other symptoms of that set could be because of another condition. So it's always helpful to know the symptoms that we are having, and then we can initially try to figure things out on our own. And if we are not able to, then we should seek help. Now, women, I know you are asking me about a particular age group, but honestly, women have all the right reasons to not have good sleep from pretty early on as an adult. Starting from the monthly cycles, the hormonal imbalance that goes in, to like usual pressures with college and career and all that. But pregnancy does a number, and so does childbirth and child rearing. When you are raising a child from newborn, toddler, getting older, the sleep loses its quality at that point when children are young. And it is difficult for a lot of women to get that quality of sleep back, like how it used to be when they were younger, like younger meaning before they had children. However, because they're still young enough, they are able to like manage with whatever sleep they get until it becomes unmanageable. And by that time, they are either perimenopausal or they have just hit menopause or something like that, is when things finally hit them and they realize that, okay, at this point, they have to seek help. So I'm specifically talking about the problem with insomnia, which I like to look at it as a symptom. Okay. Now, there could be sleep apnea too in it, but we don't know, right? So initially, when people are having a set of symptoms and they haven't approached help yet, they can see if some of the things to do with their mindset can help their sleep, such as treating their sleep as a person, like, having respect for their sleep, meaning allowing a nice opportunity to be able to sleep. In this day and age, we do tend to sacrifice our sleep. We do tend to browse on our cell phones in our bed. And sometimes we come across interesting things. Then we want to finish reading that up or whatever. Sometimes we do online shopping at that time of the night in our bed. Or some women are trying to finish the rest of their work, meaning their work on the computer, for that day, catching up with the emails. If nothing, they're washing the dishes or whatever, trying to wrap up the kitchen. So what ends up happening is they sacrifice their sleep in order to get all these things done. And that's huge. So always allocating a certain time for sleep and respecting that time is important. We don't need a cell phone in our bed. We truly don't need a cell phone in our bed. We can manage our time a little bit better and try to do our dishes within the acceptable time frame. If we are not able to, we should feel free to ask help from our spouses. A lot of women don't do that. They take it upon themselves. Oh, it's my job. It's my job to do everything. It's my job to do this. It's my job to do that. And at some point, it's everybody's job. And very likely, you can get spousal help or your children's help, depending. I wouldn't bank on children as much. So respecting your sleep, looking at sleep like it's a person, liking your sleep is very important. You have to like your sleep. If you don't like your sleep, you're not going to be able to sleep. So how can you like your sleep? This is by understanding that you need to make your environment conducive to sleep. So lavender, essential oils, whatever, blah, blah, like having a shower, whatever helps you calm down, changing the curtain, color of the curtain or the color of the wall, making it more soothing, having a crystal, a pink quartz or whatever by your bedside, something that kind of symbolizes positive energy and relaxation, things like that. So once you do that, then the next step is to always wake up at a consistent time and going to bed only when sleepy. Don't just go to bed just because it's time to go to bed and you are just so alert in your head and your mind is racing. It's no use going to bed at that time. So help yourself calm down, wake up at a certain time consistently. And there are some other do's and don'ts when it comes to sleep, such as before going to bed. So we all watch TV, right? And at this point, we're all addicts to devices. Always watch TV or laptop or whatever, movie or anything outside of the bedroom. Having that boundary is very important. And then making sure that we don't watch anything at that time of the night that can trigger our thoughts or that can make us more alert. That's very important. So watching a movie that we have already watched 5 times, so that's fine. Avoiding news channels, crime, any fiction or games, things like that. Watching avoiding those sort of programs is also important. So liking your sleep and doing things that actually help you sleep better is important. Now you have done all these things and sleep is still not getting better. Now there could be symptoms of restless legs. People have creepy crawlies or uncomfortable sensation in their legs that starts in the evenings, gets worse as the evening progresses, and then you have to keep moving your legs around to feel better. That's restless leg syndrome. Well, then you need to get help for it. If you have sleep apnea, are you snoring? Are you waking up gasping for air? Or is your spouse seeing some apnea? Meaning, do you stop breathing in sleep? Things like that. So there could be other concurrent problems that could be going on that could interfere with our sleep. So, and menopause, perimenopause is the right age. Hot flashes, how do we manage that? Yeah.
It's a huge field, but wealth of information. And, you've touched upon some really important ones, which I think would be of interest to a lot of women and, a lot of parents. But again, I think the best thing is to get things evaluated if you have any concerns. But those suggestions, for general sleep habits and practices are really helpful. So I want to thank you for sharing all of that information, Dr. Kamala. We'll now move on to our next segment, which is your X Factor. And here I'd love to learn about your personality and also the kind of initiatives that you're involved in outside of your work, so your extensional activities and stuff.
As much as I love the line of work that I'm in, I like to, or at least I try to not identify myself too much with it. I want to do other things that also bring meaning to my life. And community service is a big part of that. I'm not saying that I do a lot of it or to the extent that I want, but I try to whatever I can in whichever capacity I can. And one of the capacities is, or one of the ways that I was able to is by contributing at the temple that's close by, and contributing to the education amongst the Hindu youth or children. That's that's very close to me. That hits home. I was always particular about bringing my children to the classes there every Sunday. My older one used to be very adamant about not going, but I would offer incentives or whatever. I would say, just don't learn, just come, things like that. And I would, but I would somehow end up like making sure that they were in the premises, in the classes, just spending time there. It was very important to me. And as time went, I started contributing there. I started teaching. Then I did other sorts of volunteering there. When the pandemic happened, high schoolers couldn't get volunteering opportunities. So they somehow something happened and they started reaching out to me, and we formed a group where children could actually volunteer at the temple to get their community service hours, or other things that they wanted to do, so they could like write something in the college apps. So we were able to like extend that sort of a resource to the kids at the time. And then we just have been developing on the education that's being imparted at the temple now. This year would be 10 years, completion of 10 years. We initially started with Pragya, but we changed to the temple, changed to temple-sponsored curriculum, which is all-inclusive a Hindu curriculum, where we talk about all deities, regardless of the sects. And we also talk about related religions and not just Hinduism. We talk about the history of India and other cultural events and activities, and we try to celebrate the major events that are related to our Hindu religion in fun ways. So contributing that way has been very fulfilling to me. Being an educational coordinator there has been very fulfilling to me. I'm not sure how long I'll keep doing, but I'll do as long as I can, and I would want to improvise on that, like maybe pick up an art that encourages native artists in India, helping them with, having a nonprofit sort of deal, helping the native artisans like make money and things like that.
Our
Yes.
next segment is self-care, and here I'd love to hear all about your self-care routine. What do you do to keep yourself in great shape? And also, how do you take care of yourself mentally, emotionally, physically, and spiritually?
Paying attention to my needs, little wants and desires is something that helps me, because that was something that I wasn't taught to do, and I had to learn to do that. And that is something that I take deep pride in. I don't hold off on doing something small that means something to me, that is, suppose say like going for a massage or whatever. If I feel like having one, then I'll go get one done. I'm not going to like deprive myself of that. If I want like some piece of jewelry, depending on how much I have, depending on how much is affordable, I'll get something. Like if I can't afford gold, I'll get something that's fashion jewelry. Like I'll get that to just satisfy that desire. And understanding that we are materialistic. No matter what, humans are supposed to be materialistic, is what I believe. Okay. And it's important to fulfill those, at least those small, simple, materialistic desires. And if there are something big and unattainable desires, then I leave it to God, and um, I'll still keep it in my list of desires, but I will uh, give it over to the higher power, and tell the higher power that if you think I need to have it, then you will send it my way. Otherwise, I understand. So being able to let go is also important. There is giving myself a lot of downtime is very important to me. I have to have that downtime. When I come back from work, and I have been trying to help all the people with mental health problems and stuff, I have to come and just give myself that space to just cool down. And the rest of it is being able to go out, because I'm just a homebody. I don't like to go out on vacations. Or for me, vacation is just being at home, having a cup of coffee with a samosa or something. That's my favorite pastime. That's vacation for me. Being able to look at the sky. If I'm able to see some planets, then I feel good about it. Other than that, so my dogs help me to step out of the house, go out for walks. Plus, I have my own small exercise regimen of doing things like steps or some small weights and things like that. I don't go crazy over exercising or being active, but I'm just active enough to just keep myself, at least to try to keep myself in shape. The other thing is diet. Diet is of utmost importance. You may or may not exercise, but if the diet is not good or is not healthy, then our health will very likely suffer. So, just trying to have those basic healthy meals is important for me. And I feel the best when I have those basic healthy meals made from scratch. Plenty of water is another one. I have a prescription for myself. I have to have this much water, because otherwise you forget. Like, there is very little time for self-care in a day, and realizing that, then what can we do is, so I have come up with a set of small things that are doable, that I try to do.
But you're also very spiritual. You want to talk about that
Yes.
aspect, and what does that look like?
So there is a lot of overlap between being religious and being spiritual. So for me, spiritualism is wishing good for others, is being able to be neutral when it comes to uh, conflicts. Not taking sides, whether it is a conflict involving me or others. Um, um, Being able to be compassionate, that's spiritualism for me. And then I try to use my religion to inculcate that spiritualism in me by saying my prayers in a way that it helps me shape my mindset to get to that spiritualism.
It's been a great conversation, Dr. Adury. I really am very grateful to you. You are one of those people who has done a great job of playing the hand that you've been dealt with in a very beautiful way. You're somebody who's very authentic, is not apologetic about a lot of things that you believe in. And, like I know that one of your strengths is going the extra mile to do the right thing, for others and for yourself. And it's really refreshing and great to see you walk the talk. So on that note, any parting words from you as we wrap up this show? Anything that you want to share with our audience?
Taking care of yourself. For women, the most important thing that women need to do is to be able to take care of themselves. Whether they work or not, whether they make money or not is a different matter. They need to put the time aside for themselves, a little bit of time at least aside for themselves, and to make sure that little desires, their little wants, they not do not expect somebody else to fulfill those wants and desires. Just go get those things. What women are the pillar of not just the family but of the society too. But women also are the ones who shove their needs under the carpet. Most of the time, I saw my mom doing it. I saw my grandparents, my mother doing it. I see so many of my friends doing it, so many of my patients doing it. Women across the board just shove their needs under the carpet, and that is something that is not healthy for raising healthy kids. It's not healthy for the society. It's not healthy for the country. So I would strongly encourage women to stand up and just take care of. You don't become selfish just because you're taking care of yourself. We don't. We are not selfish. We are those selfish hormones. We don't have those hormones.
I can't thank you enough for taking time out of your very busy schedule and sharing some wonderful advice, information, knowledge with our audience. And I'll also be sure to share the address of Dr. Adury's practice so that if anybody wants, you can reach out to her. And on that note, I want to thank you once again, Dr. Kamala Adury, for coming on my show and giving me this opportunity to have this conversation with you through this podcast. It's been a pleasure.
Thank you so much, Anu, for giving me this platform to be able to talk about myself and to advocate for women. I truly appreciate the work that you do. Thank you so much.